But you want to keep watching all afternoon because Jet with the perfect season will have the #1 plate ceremony for Hunter coming up. I want to shout out to our buddy, the good Dr. Joe McGinley of the McGinley Clinic. Held a symposium for some of the parents and riders at our amateur moto scouting combine yesterday. Let's talk about this week's topic with Dr. Joe.
So if you cramp that outflow, I'm Dr. Joe McGinley. This week on the McGinley Clinic Medical Minute, we're going to be discussing Achilles and ankle injuries. The Achilles is a major structure in your ankle. It supports your ankle, it supports your foot, and it's a shock absorber. When you land on a jump, your Achilles will take a lot of the force and will take a lot of the impact from that jump. Positioning is key. If you're positioned on the bike, balanced over the front of your foot, the balance between the impact on your foot and the Achilles will result in a soft landing. However, if your foot is somewhat pushed backwards or somewhat positioned backwards, the Achilles can hyperextend. Well, we've all seen the injury for Eli Tomac, and it was hard to watch, really. But that does happen. You know, his positioning on the bike was correct. He had the right gear, he had the right protection. But these things can happen. Even when everything's perfect, when you're well-trained, when you're stretched, when you have the right gear, you can still injure any structure in your body. When the injury does occur and you do tear your Achilles, you need to get that looked at. That typically requires a surgery. Oftentimes, the surgeon can reconstruct the Achilles, and then you have a recovery period of typically several months. However, most people can get back out there if it's done correctly. At our clinic, if someone injures their Achilles requiring surgery, we often will supplement that surgery with platelet-rich plasma, or PRP. This will help accelerate the healing of the injury and help get that back stronger and better. So how do you prevent this? Well, first is recognizing when the Achilles is irritated and maybe abnormal. You really shouldn't feel pain in your Achilles. If you're feeling Achilles pain, you need to get that looked at. Stretching, making sure you stretch before you get out on the bike. Strengthening the muscles around the ankle, strengthening the gastroc and soleus, but making sure you have the proper range of motion. Making sure your boots are comfortable, making sure you have boots that are protective on your ankle and on your Achilles. It's your body, it's your sport, it's your choice. I'm Dr. Joe McGinley with the McGinley Clinic Medical Minute, innovating treatments for lightning fast recoveries.
All right, great to have Dr. Joe McGinley with us all year long.